A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Nirav Ganatra sir. And today's topic will be reviving resilience, the role of homeopathy in enhancing quality of life in AIDS patient. As we all know, today is World AIDS Day. And so let us have a small introduction regarding sir. So just give us a minute. And so sir has been MD homeopath from Organon of Medicine and research coordinator, AIHSAYA Homeopathy College, Gardi, Vidyapith. And sir has also been NABH coordinator, Gardi Hospital, and assistant professor from the Department of Organon of Medicine and AIHSAYA from AIHSAYA Homeopathy College and Gardi Vidyapith. Sir has been a examiner as well as member of many committees, and sir has also presented many papers and also written many articles also. We welcome you, sir. We welcome you all the participants for the today's wonderful session. Hope it will goes well. And over to you, sir. Thank you.
Thank you, ma'am, for the wonderful introduction. We will be moving towards the today's topic, that is reviving resilience, the role of homeopathy in enhancing quality of life in AIDS patients. As we know that AIDS patients suffer a lot, not only physically but also at the mental plane also. So in that case, how we can support the patients of AIDS in their suffering on the physical plane as well as on their psychological plane. So this session has been aimed especially on the World AIDS Day for creating awareness regarding what the AIDS is, how does it spread, what are the myths and facts related to the AIDS, and how homeopathy plays a pivotal role in enhancing the quality of life of the AIDS patients. So mainly focusing about what is AIDS, starting with what is the root cause of the AIDS and what is why I have selected this topic. World AIDS Day is observed every year on December 1st to raise awareness about the global HIV AIDS epidemic and demonstrate solidarity with those living with the virus and remember those who have died from AIDS related illnesses. It was first celebrated on 1988 and is marked by various health organizations, governments, and communities worldwide to highlight the importance of prevention, treatment, and support for people living with HIV/AIDS. The observance and today's session aims to reduce the stigma surrounding the disease and promote safe practices and policies for those who are affected. Let us first of all see what is actually the AIDS. In this condition, the person, the full form itself, it suggests acquired immunodeficiency syndrome. It is the final stage of HIV, that is the human immunodeficiency virus infection, where HIV attacks the body's immune system, specifically the CD4 cells, T cells, which are essential for the immune response. And in this condition, if untreated, HIV can progressively weaken the immune system, leading to the development of the AIDS. At this stage, the body becomes highly susceptible to the opportunistic infections and certain types of cancers also, which can be life threatening. Actually, the patient of AIDS doesn't die because of the disease itself, but the suffering of the patient increases because of the weakened immune system of our body. The HIV virus, which is attacking the body's immune system, with that is the specifically CD4 cells, T cells, which we say, which are essential for our immune response, progressively weakens our immune system of the body, and those people become vulnerable to various kinds of opportunistic infections. Either they may be because of bacterial infections, viral infections, parasitical infections, and sometimes it becomes the soil for the seed of cancer to metastasize and kill the person. So these are you can say the physical aspects or the physical symptoms which are developed due to the HIV, that is acquired immunodeficiency syndrome. If we see to the global prevalence, this is the epidemiology. Why we need to aware the people? Here lies the question. That today itself, in one of the session arranged at our Gardi Vidyapith, where we invited Dr. Arun Dave, that is the, you can say, chairman of AIDS Prevention Committee or AIDS Prevention Center of the regional center of our Rajkot itself. He said every day, if we calculate the monthly average or yearly average of AIDS infected patients, every day at least one more patient is identified or diagnosed in every area of the city, which is leading to the global prevalence which is present before you. The global prevalence of HIV/AIDS continues to be a major public health concern. As of 2023, there are approximately 38 million people living with HIV worldwide. Transmission rate, if we see, sub-Saharan Africa is the region most affected by the HIV/AIDS epidemic. However, HIV is a global issue affecting people in all the region, including Eastern Europe, Asia, and America. Name of new infections, despite global efforts to combat the virus, there are still an estimated 1.5 million new HIV infections every year. The prevalence of HIV is higher among certain vulnerable groups, including men who have unprotected sex with men, sex workers, and people who are injecting drugs. Risk factors for HIV, if we see, unprotected sex, sexual activity, having unprotected sex with an infected person, either through any of the routes, either that is vaginal route, anal route, or oral route. It is the most commonest mode of transmission. Sharing needles or syringes while injecting drugs, who share the needles with which they are the parental route of transmission of HIV comes into the blood transfusion and organ transplants, receiving contaminated blood or organs, especially in regions with inadequate screening, can result in HIV transmission. Mother to child transmission. HIV can be transmitted from an HIV positive mother to her child during pregnancy, childbirth, or breastfeeding. Having multiple sexual partners or engaging in risky sexual behavior increases the likelihood of HIV exposure. Pathophysiology, if we see, mainly the aspect which we are focusing is about the weakening of the immunity. Immune system is being weakened by the HIV virus. So starts with the entry of the HIV virus into the body. HIV is primarily transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. It does not transmit through, we can say, saliva. It enters the body through mucosal surfaces such as vagina, urethra, or rectum. Targeting CD4 cells, the virus infects and destroys CD4 plus T cells, which are the crucial cells for the immune response. And if these cells are being weakened, then they are the responsible for activating other immune cells. So if CD4 plus T cells are being weakened, macrophages and cytotoxic T lymphocytes will also being not get activated, ultimately leading to the immune system dysfunction. As the number of CD4 cells declines, the immune system becomes severely weakened and the body becomes more vulnerable to various other kind of infections like bacterial, viral, and parasitical and cancerous conditions also, ultimately leading to the progression to AIDS, which is diagnosed when CD4 count when falls below 200 cells per microliter, or when they develop certain opportunistic infections or cancers. Etiology: HIV is caused by human immunodeficiency virus, which is classified into two types, HIV-1 and HIV-2. Most common and widespread type for majority of HIV infection is HIV-1, and the HIV-2 is primarily found in West Africa. As we discussed, it is being transmitted through contact with infected body fluids, including blood, semen, vaginal fluids, rectal fluids, breast milk. Sign and symptoms, if we focus on acute HIV infection, that is from 2 to 4 weeks after exposure, being developed into fever, swollen lymph nodes, sore throat, rash, muscle and joint aches, diarrhea, headaches. These symptoms resemble flu-like illness, and many people may not realize that they are infected. In chronic condition, no symptoms through the virus still active, but it gradually weakens the immune system. AIDS symptom. When once the system is severely compromised, individuals may develop symptoms related to opportunistic infections and diseases such as chronic diarrhea, weight loss, cachexia, which we say, persistent fever, night sweats, dry cough, or shortness of breath, memory loss, or neurological impairment, recurrent infections of pneumonia, tuberculosis, candidiasis, Kaposi's sarcoma, or other cancers related to any kind of lymph nodes. If we see the variety of, or we can say the types of laboratory investigations for HIV/AIDS are HIV antibody test, starts with the antibody test. These tests detect the antibodies against HIV in the blood, indicating that a person has been infected. The ELISA, that is enzyme-linked immunoassorbent assay, which is the most commonest test. HIV RNA PCR, that is polymerase chain reaction. This test measures the amount of HIV virus, the viral load into the blood. It is used to diagnose early infection and the monitor treatment effectiveness and also predict the disease progression. CD4 cell count. This test measures the number of CD4 T cells in the blood, which helps assess the degree of immune system damage. HIV drug resistance testing. This is done to check for mutations in the virus that may reduce the effectiveness of antiretroviral therapy. Other laboratory tests which may include is like CBC, liver and kidney function test, screening for opportunistic infections like tuberculosis, cytomegalovirus, toxoplasmosis, etc. Differential diagnosis. It is a very important aspect because this AIDS has been misconceived, or we can say confused, by the two different other types of diseases. Acute retroviral syndrome, that is early HIV infection, can resemble flu-like illness or other viral infections, for example, mononucleosis, etc. Hepatitis B or C. These viral infection can also present with similar symptoms like fatigue, jaundice, and liver abnormalities. Syphilis and other sexually transmitted infections. Certain STIs may mimic symptoms seen in HIV infection. Tuberculosis and other opportunistic infection can occur in HIV patient, should be differentiated. Cancer, lymphoma, or Kaposi's sarcoma. Conventional treatment, if we see for HIV/AIDS, that is our antiretroviral therapy, that is ART, which we say, and is the cornerstone of the HIV treatment. Drugs from different classes to suppress the virus are being used. For example, that is nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitor, integrase inhibitors, entry inhibitors. ART does not cure HIV, but reduces viral load to undetectable levels, allowing the immune system to recover. Prophylactic treatment, that is preventive aspect. People with AIDS are often given medications to prevent opportunistic infections such as pneumonia with antibiotics or tuberculosis. And if we see to the recent update, just 25 days before, there has been invention of a vaccine by World Health Organization for the AIDS negative people. The people who are not having AIDS infection can take and have a partner who is being prone, or a partner who is being affected with the AIDS. They might be benefited with this vaccine, because those who are already being affected with the AIDS itself, they are not going to get any benefit from this vaccine. But we can say the people who are AIDS negative and are being associated with people living with HIV/AIDS positive condition may take this vaccine, which has been presented by WHO just 25 days before. Management of the opportunistic infection will be done in the conventional treatment so that any kind of which involves antifungal, antiviral, or antibiotic therapies, depending on the specific infections a person develops. Regular monitoring, patients undergoing ART should have regular follow-up visits to monitor viral load, CD4 count, and drug side effects. These parameters are very much important while going under through any kind of treatment, not only the conventional treatment, not only the homeopathic aspect. But if this viral load, CD4 count are not monitored, then there may be the chances patient might undergo fatal disease conditions. So how much viral load has been decreased or how much viral load has been increased with after or before the conventional treatment, CD4 count cells, how much they are increased or decreased are being seen into it. Supportive care, treatment of symptoms like pain, diarrhea, or weight loss, as well as psychosocial support for individuals living with HIV is essential for improving quality of life. Now, the aspect which we are focusing today is about the quality of life dimensions in HIV. Quality of life among HIV patients typically includes physical well-being. As we see, because of the weakening of the immune system, so many we can say symptoms of various kind of diseases are being seen into the person. It weakens the person's stamina also, so the energy levels, different kinds of the pains, symptom burden is being seen in the patients of HIV. Psychological well-being, after getting a tag of HIV/AIDS positive person or patient may undergo depression, anxiety, and face a serious coping mechanisms for the particular aspect. Social well-being, relationships, stigma, support, the society, even the people who are directly related to the patient may break the relationships, friends stay away from this person. So the stigma because of these lack of support and declining relationships bring about various ecological defects and depression into the patient. Functional well-being, because of this physical and mental inability, the patient develops disability to work, defects in the daily functioning. Spiritual well-being also gets disturbed from this. And to meet all these changes, the only holistic system which helps in upgrading the quality of life in HIV patients is our homeopathic system of medicine, which not only focuses on the sign and symptoms of the patient, but also focuses on the psychological well-being, psychosocial well-being, functional development of the patient, and finally improvement into the physical aspect of the patient. How homeopathic management of the AIDS can be on, as we already uh, saw that homeopathic system of medicine is the holistic system which treats the individual as a whole, which treats the individual in the disease and not the disease in the individual, considering physical, emotional, and mental well-being. It uses highly diluted substances, which, according to the principles of homeopathy, stimulates the body's own healing mechanism. Because, as we all know, that high doses, stronger doses, suppresses the system's functionality, whereas small doses, lower doses, stimulates the body's immune system and the healing mechanisms. When it comes to managing HIV/AIDS, homeopathy is typically viewed as an adjunct to conventional treatment rather than a standalone therapy. While there is no homeopathic remedy that can cure HIV/AIDS or eliminate the virus completely, certain remedies are used to support the immune systems and to alleviate the symptoms. In previous few years, I have also seen in few of the cases where the total viral load has been reduced to a remarkable margin, and the CD4 plus count cells has been also increased, which may be considered as the cure of the disease. But as we see, we care not only our homeopathic system of medicine, but different systems of the medicine also are being seen as the supportive treatment itself, because complete cure of the AIDS is very difficult to achieve, but not impossible to achieve. Potential mechanisms in homeopathy for care of patients suffering from HIV/AIDS. To research on homeopathy's mechanisms is evolving. Several theories help explain its supportive role. How homeopathic system of medicine works in the cases of the AIDS. First is by immune modulation. Some studies have reported that certain homeopathic remedies may influence immune markers such as cytokines, macrophage activity, or oxidative stress levels. Although not a substitute for ART, such modulation may support overall resistance. So we have also read in few of the materia medica literature that Bacteria is elevating the immune system cells to fight against jaundice. In the similar way, many remedies like arsenic, which has been termed as antiviral medicine, antiviral homeopathic medicine, and many other medicines also like Gelsemium, Dulcamara, have reported to increase and influence the immune markers of our body like cytokines and macrophage activity, etc. Second mechanism is the reduction of the stress and emotional burden. As we all already learned about it in the previous slides itself, that the patient not only suffers from physical illnesses, but also is being disturbed because of the psychosomatic aspect also. So homeopathic medicines work very beautifully on our depressed mindset, psychological mindset, and helps the patient frequently experiencing anxiety, depression, grief, trauma, setbacks, irritability issues, anger issues, all because of being diagnosed suddenly with this HIV case. Homeopathy considers emotional states crucial for remedy selection. For example, aconite, arsenic alb, ignatia, natrimur. Clinical observations also help in identifying sleep, mood, and coping ability of the patient suffering from the AIDS. Support during side effects of ART. If the patient is taking the AIDS retroviral therapy or the treatment, during that, support in the conditions of nausea, peripheral neuropathy, headaches, skin eruptions, sleep issues, these all can be treated by the homeopathic treatment as an adjunct therapy. Homeopathic remedies like arsenic alb, nux vomica are frequently used to manage these kind of side effects. Enhance the sense of well-being. This is the primary aspect of, or we can say, as Master Honeyman has termed this, sense of well-being as the, can say, the required aspect for the primary treatment of the cases. Sure sign of treatment or sure sign of the administration of similimum is the sense of well-being. Homeopathy's holistic consultative process itself, listening, empathy, individualized care, has therapeutic value, helping patients regain a sense of. If we see to the miasmatic differentiation in HIV/AIDS, homeopathy also addresses miasms, inherited or acquired predisposition to certain diseases. As we know that this condition has been developed because of the venereal diseases. AIDS can be considered as the disease because of the transmission due to the venereal aspect. So miasmatic consideration, if we see, that is the venereal disease condition, mostly into the psychosyphilitic aspect depending upon the development of the types of symptoms. But as we all know, Sora is the mother of all diseases. Psoric miasm represents the state of weakness, unresolved chronic diseases, and susceptibility to infections. It can be related to chronic condition and affect the body's resilience to the disease, as seen in the we can say immune suppression characteristic of HIV/AIDS. Remedies like sulfur, Calcarea carbonica, and Natrum muriaticum may be used to treat individuals who have a psoric disposition to the chronic illness. Tubercular miasm involvement. The tubercular miasm is often linked to chronic infections, particularly those affecting the lungs and respiratory system. The tubercular miasm is associated with individuals who have a tendency to develop tuberculosis, emaciation, cancerous miasm.
This meeting is being recorded.
Cancerous miasm. The cancerous miasm is thought to predispose individuals to chronic diseases that can lead to the degeneration and growth of abnormal cells. People with advanced HIV/AIDS may develop cancers such as Kaposis, sarcoma, lymphoma, which may align with a cancerous miasmatic tendency. Remedies like Coniam maculatum, Aurum metallicum, and Baritacarb may be useful in preventing the tendencies in the body. Syphilitic miasm. The syphilitic miasm is often associated with debilitation, degeneration, and suppressed immunity. Who may have history of the suppressive treatments or chronic illnesses. People with HIV/AIDS may manifest symptoms such as wasting, emaciation, skin ulcer, and opportunistic infections, all of which are associated with syphilis. In homeopathic thinking, remedies like mercurius, syphilinum, and kaliiodatum are often prescribed to address the syphilitic trait of this miasm and its effects on the immune system. As we know, the syphilitic trait directly, the immune system is the very important. You can see the syphilitic miasm is particularly related to the deficiencies of the immune system. Immune system has been directly affected in the case of syphilitic aspect, as we see into the psycho endocrinological or neurological stem. In that, immune system is being the most important aspect, and when it is being affected, we can consider to be the miasm responsible for the condition will be the syphilitic miasm. If we see to the repertorial aspect, next we are going to see about is the repertorial aspect of the condition, in which we would be seeing involving or using the homeopathic repertory to identify and select the most appropriate remedy based on a patient's symptom. A repertory is an essential index or catalog of the symptoms which organizes remedies according to specific characteristics, both physical and mental. The repertory helps the homeopath in matching the symptom totality, all symptoms experienced by the patient, to remedies that are likely to cure or alleviate the symptoms. Although AIDS is not explicitly listed as a disease in classical repertories, but depending upon the type of symptoms which are manifested by the individual, depending upon the severity of the different symptoms and characteristic aspects in the patients suffering from the AIDS, homeopaths use a symptom-based approach to repertorize the various manifestations of the HIV/AIDS, such as chronic infections, fatigue, skin conditions, diarrhea, mental emotional states, and other related symptoms. How to build up the repertorial totality in the case of our HIV/AIDS condition? Identifying the key symptoms. HIV/AIDS presents with a wide range of symptoms, both physical and psychological. When using a repertory, a homeopath will focus on the key symptoms that present the totality of the disease. Common symptoms seen in HIV/AIDS include physical symptoms, which we already listed, that is fatigue, chronic diarrhea, fever and night sweats, opportunistic infections, fasting syndrome, skin conditions. Mental and emotional symptoms, which may be leading because to depression. It is the common symptom due to the chronic nature of the illness. And emotional toll, fear and anxiety, fear of death, fear of infecting others, and anxiety due to the unpredictable course of the disease. Grief over the diagnosis and the impact of the on the patient's life and relationships. Despair, a feeling of hopelessness, or a sense of impending doom. Irritability and frustration due to the chronic nature of the illness and long-term treatment regime. Repertorizing the symptoms will get different aspects into the different chapters, like anxiety into the mind, depression from mind, weakness from generalities, rashes in the form of eruptions, ulcers or rashes from the skin, diarrhea in the aspect of the stomach chapter, cough, night sweats, and the final step would be the selecting the remedy. If we see to the different varieties of the medicine available for the management of the AIDS condition, we have the topmost remedy, that is arsenic alb, which is considered as antiviral homeopathic remedy. Not only into the AIDS, but in many conditions, many viral infections or viral diseases, arsenic alb has proven itself like a blessing from the homeopathic system of medicine. Prescribed for individuals who are experiencing anxiety, weakness, and fatigue. It is also used for people suffering from chronic diarrhea, which can be common symptom in HIV/AIDS. Symptoms including emaciation, extreme weakness, burning sensation, or desire for warmth. These are the key symptoms of arsenic alb. Phosphorus is indicated to the people who are emotionally sensitive. Due to the AIDS having a low immune response and helpful in managing their bleeding gums, coughing, and respiratory infections, which are common in those with weakened immunity. Symptoms including excessive thirst, dry mouth, frequent colds, susceptibility to infections. Person may also experience weakness and fatigue. Management of HIV/AIDS with the medicines like Cilicia, tuberculinum, lycopodium helps in the anti-miasmatic treatment. Cilicia for antipsychotic aspect, tuberculinum for anti-tubercular aspect, where tubercular miasm is into the role. This remedy is indicated when the cases of pulmonary tuberculosis commonly affected and prescribed to the individuals who are prone to lung infections, having diastasis, scrofulous diastasis, chronic cough, and weakness. Symptoms including tuberculosis and poor appetite, often indicated when respiratory diseases are a concern. Lycopodium, the right-sided remedy for all the digestive issues like indigestion, bloating, flatulence, also helps improve energy and mental clarity. In individuals with HIV/AIDS who suffer from these gastrointestinal symptoms, main aspect is the lack of energy and fatigue. which is being seen most prominently in the lycopodium. Management of HIV/AIDS with homeopathic medicines. Netromure indicated in the condition where a patient has been broken down mentally with having emotional blockages, prone to depression or grief, skin conditions such as eczema, which is common in HIV positive individuals, symptoms like depression, sadness, grief. People who need this remedy may have a tendency to bottle up emotions and feel emotionally withdrawn. We can see socially, psychologically broken down patient must be given netromuraticum. Califos in the case where nervous debility is the main aspect, weakness, mental exhaustion, stress, fatigue, all have been seen in the marked cases. Mental exhaustion and nervous weakness are the key symptoms of the califos and indicated or primary indications for AIDS condition. Next are one of the herbal remedy, that is Indian remedy, echinacea. More commonly used in herbal medicine, echinacea is sometimes used to enhance the immune system, particularly cases of the recurrent infections. Supportive measures which improves the quality of life of the patient and being requested to the society to support the patients suffering from the AIDS. Homeopathy also includes auxiliary measures which are being explained from 290 to 294 aphorism in Organon of Medicine, 5th edition. These might be used to address chronic fatigue, pain, emotional disturbances. Mental and emotional support, remedies for anxiety, depression, remedies like argentum nitricum, aconite, or ignatia can be used to help manage feelings of fear, anxiety, grief, which are often associated with living with a chronic illness. Emotional healing, if we see, homeopathic treatment aims to support emotional healing, which can be crucial for individuals coping with a long term illness like HIV. Energy and fatigue, remedies like China, Jalsemium, and Netromphos can help individuals suffering from chronic fatigue or weakness by boosting vitality and improving energy levels. Concluding the session, 1st December, celebrated as AIDS Awareness Day, I request all the homeopaths to spread the awareness about the myths related to the AIDS. In homeopathy, HIV or AIDS would be seen not just as a viral infection, but as an illness that reflects the deeper condition, the deeper illnesses, systemic imbalance, potentially affecting the individual's physical health, mental, emotional well being, and vital force. Homeopathy may offer symptoms which relieve and enhance the quality of life for individuals living with HIV/AIDS, especially when combined with the conventional medical treatments. When approaching a chronic complex illness like HIV/AIDS, homeopathic treatment considers both the constitutional, that is, physical and emotional aspects of the individual, as well as the mathematic background of the disease. It should always be used cautiously and as a part of a comprehensive treatment that includes antiretroviral therapy and appropriate medical monitoring. So, with this, I conclude my session. I heartily thank AIHSAYA, that is our All India Homeopathic Youths and Students Association, for giving me opportunity on the occasion of World AIDS Day to spread word of mouth regarding the awareness session for the AIDS condition. I thank Lavanya Madam. I also thank King Shuk sir for providing this opportunity to present my and share my knowledge with the community. Thank you, madam. I conclude my session and would be thankful to Aisha for providing this opportunity.
Thank you, sir. Thank you so much for the in-detail session regarding the quality of life in AIDS patient. It is a quite need of the hour to give some support and awareness to the patients also, as well as awareness to the people also. And respected participants, if you have any questions, kindly put in the comment box, or you can interact with sir. Yes. I hope they were clear with the topic, sir. Thank you, sir. Thank you so much for a wonderful session. We would like to have looking forward for many more, sir, for the sessions also. And we'll be glad that today we have some support to the like patients suffering from AIDS, and we have given some moral support also in spite of that their situation also during their work. And thank you, sir. Thank you so much. So we'll be
I'm
back
also
with the tomorrow session. Yes, sir. Sir. Yes, sir.
I was just taking the vote of thanks or
Yes.
providing me the opportunity. Thank you,
Yes.
ma'am.
Thank you, sir. Thank you so much. It's our privilege that we have got you to the on the board regarding to have a session regarding the AIDS patient also. And thank you, sir. Thank you so much. Yeah.
Thank you.
We'll be looking forward for many more sessions, sir. Yeah.
Thank you.
Thank you all. So that's all for today. And I hope you have a good session today. So we'll be right back with tomorrow session. Thank you.